So it's a pleasure to be here today for the Durant Lecture Award. My name is Jack Temple, and I'm the Senior Director of Pharmacy here. And I am going to turn it over to Tom Bilkey for our welcome and opening remarks.
Well, thank you, Jack, and it's my honor to be here to open up this particular event with some remarks about Kristin. I was fortunate enough to be Director of Pharmacy at UW Health when Kristin arrived as a resident with us, so I have a lot of familiarity with what she did as a resident, but also followed her career at Freighter over the last 30 years, and I can maybe make a few remarks about that. Kristin comes from quite a family of pharmacists, and I think some of you that are around a long time remember Dick Krumbiegel. And Dick was a community pharmacist in Madison, very active in WPHA and ASHP and WSHP, and then later in the start of the PSW. And he of course, was very much familiar with our program, and we participated with him when he was internship chairman. And then, of course, Kristin's son, Connor, this last year graduated from our residency program in 2021. So quite a legacy of the Krumbiegel family. From there, from high school, in the residency program, Kristin started in 1989, coming out of University of Minnesota, a pharmacy school, and was here until 1991. As you know, we always reach out to various residents that were in her class to get any kind of good information that I can remark on about Kristin as she was in the program. So I talked to three of her classmates that were there part of it. First with George McKinnon, and George said, poor Kristin. She had to be in the residency program with Tim Tullis, Wayne Bohannick, and Lance Moran. And she had to be a saint to be part of that particular group. She was definitely mature, one of the group, and she was always positive and very respectable of everybody. Wayne said, she's a straight shooter. I can't think of any material that would be any kind of roast material for this particular presentation. She was a great person, hard worker, and I enjoyed sharing an office with her. Lee Vermeulen, who was with her in his first year as a residency, said she always stayed out of trouble, even though she was in a class with Wayne, Tim, and Lance. Kind of a continuing theme there. She was caring and helpful to me as a first-year resident. She always helped me and was never too busy to just coach me. So in talking to the various people that she's worked with at Freighter over the years, I think there's a certain theme that comes out that made me think of a little bit of the Boy Scout law, and that is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent. That, I think, describes quite a bit the kind of person that Kristin is. She got out of the program and went to work at Freighter. And of course, we all know that she has continued on, and she is now at Freighter for over 30 years. Her first job was as Assistant Director for Clinical Pharmacy Services. And those of us that worked with Kristin when she was a resident, she did a lot of work and emphasis on the clinical side of the practice, as well as working with administration. So it was an excellent job for her to get into. So she started that, and she was in that position until 2003, and then she was promoted to medication safety officer, and that's a position she has continued on throughout her career. And within that particular job, she was the coordination of the entire quality plan for the department and all the quality projects. She was the PGY2 medication safety residency coordinator. And the biggest part of her job, and she's continued that throughout, is she is the enterprise residency program training coordinator. And she told me today there are 15 different residency programs at Frederick today and 41 different residents. So quite a responsibility. Many accomplishments she had, and a lot of them were involved in medication safety. And she became an advocate for the Six Sigma process. And so if you look at her resume, there's several items on there that were Six Sigma projects that she used to really show and showcase some of the medication safety things that she had done. And she became very involved in Six Sigma. She became a black belt in 2003 and a green belt in 2005. And I'm not sure there's any other residents in our program that have got involved in that and achieved that expertise in Six Sigma. She implemented several IV infusion projects within the program, as well as some things having to do with medication safety, medication use process. She has mentored over 50 PGY1 residents as the program coordinator of that particular program. She's also developed the PG1 community pharmacy residency and PGY2 administrative residency, critical care residency, and oncology residency at the Frederick Hospital. She also is involved in the research center there, the Investigational Drug Service. She took it over. They had 8 clinical trials, and today there's over 200 clinical trials that are operating at the Frederick Hospital. She's been very involved in organizational work. She at ASHP, she's part of the Medication Safety Advisory Group. Of course, involved in residency. She was on the Commission on Credentialing from 2006 to 2012, and she chaired the Residency Commission in 2011. She also has been a practitioner surveyor as part of the commission, and she's done that since 2006 and continues to go on residency accreditations to this day. As far as other organizations, she was involved in certainly in Vizient, and she's involved in the quality safety program and compliance program there. She's been chair since 2020 of that particular committee, and a member since 2006. And I looked on her resume, and there's 15 different projects that she's been involved in regarding innovation and Vizient. She's also involved here in the state, a member of PSW and initially WSHP. She's a member of the Medication Safety Collaborative of PSW, and she's been on Educational Affairs Committee, which she was a chair at one time. And if you get back to the WSHP days, she was elected to the board of directors there in 1994 as secretary and maintained that role until 2001. She's an active teacher in addition to residency training. She's involved, of course, the new pharmacy school that started in Milwaukee, and she is now teaching 2 courses there, healthcare systems and patient safety, and residency exploration and preparation. And if you look at her resume, she has a list of what she calls select presentations, and there's 43 of them on that particular select list. I don't know what would be on the entire list. And she has, of course, 6 publications in referee journals. And if I looked at her a list of those, and there's an interesting one on her. Her first publication was Clinical Clerkships, Goals, Objectives, and Activities in the Clinical Clerkship Manual, edited by Larry Bowe in Applied Therapeutics. So it's a link back to a very important person in our residency program, Larry Bowe. She's also gotten some awards. She was in 1989 the Outstanding Hospital Pharmacy Student by the Minnesota Society of Hospital Pharmacists. 1990, the Benning Memorial Scholarship through WSHP when she was a resident. In 2007, she was a part of the ASHP Best Practice Award. And in 2009, she got the Research Award for her barcode scanning and safety implementation, that from Frederick Hospital. And of course, today, she can put on her resume the Winston J. Durant Award for 2021. So please stand up. And I can give you your award. Okay, this is the Winston J. Durant Lecture Award presented to Kristin K. Hanson by all past resident and current UW Pharmacy residents, February 2022. Thank you, ma'am.
Appreciate it.
It's all yours.
All right. All right, well, thank you, TT, for the introduction. I appreciate all of you joining me today, albeit virtual, totally a different realm than what we would have expected a few years ago. But I appreciate the big company this afternoon. Special acknowledgement to Jack and the team who helped kind of coordinate, troubleshoot the technology issues already. I'm glad I wasn't having to deal with that, but I do appreciate the work and the effort that's gone into this. Special thank you to DZ, Pam, and Jim. I really thank you. Each of you have played such a key role in my career as mentors, role models, and sponsors. And I'm grateful for everything you've done and your willingness to participate today and make this more robust and interesting event when we're doing it virtually. Needless to say, I'm incredibly humbled by this award, and thank you for the selection committee and the past residents who have selected me and honored me with this. As I reflect on the accomplishments of the graduates of the UW Health program, and especially those who received the award in prior years, I'm absolutely amazed to be honored in this way. In fact, it's the furthest thing from my mind. And when TT last fall sent me an email, kind of cryptic, saying he needed to talk to me and it was somewhat urgent, my mind immediately went into panic mode, wondering what was wrong. Although I could hardly put a few words together at the time, and we'll get into that shortly, it was such a memorable and uplifting phone call, so thank you. So while I've been thinking about this lecture for almost 4 months now, developing and delivering this message today is unique and different than any presentation that I've ever given. Not only am I delivering a more personal message to my mentors and my peers, but where's my PowerPoint? I've relied on my PowerPoint for so many years. So for fear of not being effective in communicating my message, I'm actually relying on a script, probably for the first time since I gave a presentation in high school. The themes of my message today are nothing extreme, yet they are core values in both my personal and professional lives. I'm glad you didn't dig up too much dirt on it. So, relationships and collaboration, and I'll build teamwork into that, mentorship, coaching, and the development of people, and flexibility and resilience. So I'd like to start with a few thoughts and reflections from the past year. Certainly we all encounter difficulties in our lives that require us to adapt to move forward. As several of you know, this past year has been a significant challenge for me as I've dealt with my own health issues. I was suddenly not only a care provider, albeit quite indirectly, but now I was also a patient within my own health system. I recognize that many of you have likely found yourselves in similar or even more difficult situations, whether it's yourself, a close friend, or family member. My purpose in sharing a bit about my journey this past year is, one, to explain why I may not look or sound like the person you were expecting to hear from today. And two, to describe how themes in my professional journey have really come full circle this past year in my personal life. I, like many of you, was looking forward to welcoming in 2021. While my family had weathered the pandemic well, I was excited to return to life as normal. Even the small things like going to the gym, dining at a restaurant, or gathering with friends indoors seemed like celebrations. Within the first couple of weeks of January, an oddly wiggly tooth developed into a gum infection. Fast forward a few months, after 4 different dental specialists, far too many courses of antibiotics, a trip to the ED for a reaction to one of those antibiotics, and 2 oral surgeries, I was diagnosed with a rare and aggressive gum disease that had already progressed to oral carcinoma. My diagnosis came the week we were graduating our residents and onboarding our new class. While there is never a good time to receive such news, this is historically one of the busiest weeks of the year for us. In hindsight, perhaps that was a silver lining, as the busyness of the week kept me from dwelling on the news I had just received. I quickly learned, however, that I needed to lean on others more than I had ever done before. July was a whirlwind between new resident orientation, my own appointments, I found myself trying to prepare myself physically and mentally for surgery while simultaneously trying to hand off my professional responsibilities to others to cover while I was on leave. As someone who has spent their entire career in an academic medical center, July is not the time you would choose to be sick and need care. But then again, we usually don't have a chance to choose that. At the end of July, I underwent a resection of my mandible and concurrent reconstruction using my fibula and surrounding skin and vasculature. 6 weeks of radiation followed in September and October. Surgery was as successful as it could have been for my case. Despite the aggressive cancer and the depth of invasion, there was no evidence of spread. The treatment, however, required me to relearn how to speak, eat, and even swallow. Recovery has been slow and tested my patience at times. And if I'm honest with myself, I didn't really feel like myself again until January. To this day, I continue to work with both my speech and lymphedema therapists to help improve my speech, mobility, and strength, as well as reduce the pain and swelling. The care I received this past year has been exceptional, and I'm in awe of the talent of my surgeons and their tremendous knowledge and skill. The entire team, and of course pharmacists included, have provided me such amazing care and a chance to see the teamwork and collaboration from a very different point of view. I'll be forever grateful for the support of my colleagues, friends, and families as they cared for me, covered for me, and allowed me to gradually ease back into my professional responsibilities. So I will keep my remarks relatively brief in hopes of making it through before my mouth decides it's too tired to talk anymore. So please forgive me if I need to pause or some of my speaking is not as clear as it should be, but we'll go ahead and get started. So let me start with a little bit of background as far as where I am today. So as TT had already mentioned, pharmacy has always been a part of my life. And in fact, many of you knew my father, Dick Crumbyville. He spent the bulk of his career, at least the part that I am most familiar with, as his director of pharmacy internship for UW School of Pharmacy. Wisconsin was one of the last states to require the postgraduate internship of 6 to 12 months following pharmacy school graduation. Interns were placed in the community pharmacies and hospital pharmacies around the state. And my sister and I used to joke that we thought my dad knew everyone, every pharmacist in the state. And we probably were not too far off because he built such strong relationships. He was a master of building relationships. And I later realized that he was a mentor to many of his students that would later become preceptors and mentors themselves. The parallels between his role as internship director and mine as residency program director cannot be overlooked. However, it was not an intentional decision. It was how my career evolved and took shape. The close-knit pharmacy community and the value of sincere friendships were further ingrained in me as my parents loved to entertain. They would often host dinner parties at our home, sometimes without the dinner, with pharmacy families and faculty. I grew up knowing that UW School of Pharmacy faculty on a personal and first-name basis. And as wonderful as these relationships were, it was also part of the driving force why, according to you, I took a left turn and went to University of Minnesota with the last name of Crumbyville. It was obvious to me that blending into UW was going to be difficult, and I needed to establish my own identity. So as much as I always welcomed being known as Dick's daughter, it was time for me to escape for at least a little bit. While it was tough to be a Badger and Gopher country at times, the decision to go to Minnesota was the right one for me. I made lots of friends, worked my way up from server to bartender at the local Radisson Hotel on campus, and gained leadership experience through my sorority. Who would have expected that my roles of pledge trainer and rush chair would correlate to residency recruitment and training? The value of relationships and connections in pharmacy first became evident to me when I was hired by UW alum and past Durant Award winner Rick Easy to work as an intern at Abbott Northwestern Hospital. I am thankful that Rick took a chance on me as an inexperienced first-year pharmacy student. As someone who learns best by hands-on experience, this was an incredible opportunity. As a student intern, I gained experience in every possible area: central pharmacy, sterile products compounding, or pharmacy satellite, and even worked with some investigational drugs. By the end of pharmacy school, I was working nearly full-time. While the money was an added perk, it was really to soak up all I could learn. I often opted to work third shift on weekends, as one of the pharmacists was there, would quiz us on drug names, doses, and indications, just another way for me to learn. Along the way, I developed some great friendships and even met my now husband, Tom. Partway through the last year of pharmacy school, I started to question, now what? For so long, I wanted to be a hospital pharmacist, and now I was just about done with school, and I was wanting something more, but I wasn't sure what. It's worth noting that residencies were not nearly as common as they are now. In fact, the rates are going down. Not nearly as common as they are now. And in fact, as a student in the BS program at University of Minnesota, residencies had not been mentioned to us even once. Fortunately, relationships to the rescue again. My dad was familiar with the residency program at UW Health and introduced me to DZ. A few weeks later, I sat down for breakfast with DZ, Marianne, and my parents, and a couple hours later, I walked out confident on pursuing the pharmacy administrative residency program. Coincidentally, just as I was making my decision to pursue an admin residency, I was starting rotations at University of Minnesota Hospital. Given my interest, I was quickly introduced to several strong leaders there, including Chuck Daniels, Shabir Samani, Paul Ramowitz, Pam Phelps, and Tom Wohler. I don't recall anything about either of my interviews at Minnesota or Wisconsin, other than Larry Bowe asking me about my less than stellar GPA, and if I could handle residency in grad school. It was a fair question, and it obviously taught me the importance of not closing doors too early. My misplaced prioritization in school, during pharmacy school, had almost cost me my opportunity, or at least so I thought, to pursue residency. Residency itself was a blur. I finished rotations at noon on a Friday and started in Madison on Monday morning. I was fortunate to live at home with my parents, where my only expense was my car payment for my new red Honda Prelude that I had purchased after my previous car, aka my parents' car, died late one night in Minneapolis. Our stipend the first year was $12,500, and almost half of that was going through tuition. With no option for moonlighting, I actually picked up babysitting jobs once in a while to earn some money. Regardless, my bank account routinely dropped below $1. There was no such thing as duty hours 30 years ago, yet I'm not sure that that would have made a difference. As I know it is for everyone, the hours are long, the learning curve is steep. To this day, I'm amazed at the amount that was packed into 2 years. In hindsight, it goes far beyond the content of the residency program. It's more about the skill set that we developed: problem solving, prioritization, collaboration, and certainly resilience. I'll be forever grateful for the guidance and mentorship of so many. In the interest of time and fear I will leave people out, I'm only going to highlight a few. DZ was busy running multiple departments. I admire not only his energy, but his level of engagement at every single conversation. His vision and insight are beyond compare. TT was in the middle of his ASHP presidency, and although he was traveling due to his ASHP commitments, we gained additional insight into organizational leadership and witnessed the strength of his relationships with others, both within the organization and beyond, and certainly the three amigos. Pam certainly was a mentor to me, but also role model as a strong female leader in pharmacy. And while she is far more outspoken than I will ever be, she taught me the value of speaking up with confidence and transparency. Early on, Pam was not a fan of the newly introduced email system. And what I gleaned from that was really the value of the face-to-face conversations, whether it's picking up the phone, face-to-face on video, or going to meet someone in person. There's no replacement. And to this day, this is something that I still try to instill in my residents and learners. Some things cannot be solved over email. I also picked up Pam's system for filing. And for those of you who worked with me, you will know that historically my desk and my office have been stacks of papers and documents. Fortunately, the combination of on-site and virtual working over the past 2 years has nearly eliminated that problem. And then finally, I mentioned Larry Bowe. Larry is my research advisor and crucial in my early development of skills as a preceptor. He was always honest with me about my strengths and weaknesses and provided feedback in a very straightforward yet nurturing manner. To Wayne, Amy, Lee, George, and Chris, I'm thankful for our camaraderie, friendship, and support appreciate your support as co-residents, both within the program and beyond to this day. I value our friendship. There was so much packed into the 2 years of residency, and the experiences during the residency are pivotal in the development of each of us as professionals. So I want to share a few highlights that tie into my career and life lessons. My second rotation was pediatrics, including the pediatric ICU. As part of the rotation, we would complete our staffing in the area. I'm not sure who thought it would be a great idea to have someone 8 weeks out of pharmacy school covering a peds ICU, but I did, and I learned a tremendous amount as a part of that. Staffing in this area meant arriving an hour early and on weekend shifts, so 5:30 a.m. to arrive to prepare for the day. I realized during this rotation how much responsibility was resting on me as a pharmacist, especially in a fast-paced code situation when some of the providers were not savvy with pediatric dosing. It laid the foundation for some of my work to come in medication safety and the importance of quote-unquote being fit for duty. I quickly learned that if I was out too late with friends or working on a project too late in the evening, I could not be the best pharmacist I needed to be the next morning. My first med-air that I know of was an order for diltiazem 30 milligrams Q6 hours that I somehow transcribed 60 milligrams Q6 hours. Fortunately, the air was caught quickly and there was no harm to the patient. But as soon as the manager approached me, all they needed to say was diltiazem, and I immediately knew what I had done. This was an early lesson for me, and the importance of the style of communication that we share with our staff whenever there is an event that occurs. Codes, codes, codes. For one stretch, there was a code every night of staff, and most of them did not end up well. To this day, I still hold vivid memories, vivid images of some, including a pediatric patient named Jonathan that I had come to know during my first year rotation. While staffing in my second year, I was called to a code in CT. After the code was called, I realized it was Jonathan. He died on his first birthday. No one talked about resilience and mental health at the time, but perhaps we should have. As a resident, I was tasked with the coordination of the upcoming Joint Commission visit, quickly followed by an ASHP residency accreditation visit. These were not tasks that people really relished to have at the time. However, it's interesting how these activities correlate so much and led to the experiences of my role in regulatory as well as residency accreditation. During my second year residency, there was a threat of a nursing strike known as the white flu. Pharmacy technicians had already been passing medications, so the decision was made that pharmacy residents would be responsible for administering IV medications and infusions. We had a couple hours of training, and I felt totally unprepared. Fortunately, there was no strike. The nurses showed up to work. But in the process, I gained a whole new appreciation for the expertise of nursing and the complexity associated with administration of IV infusions and pump programming. And then there are some things that I'm still learning, including planning ahead. Being the last minute person I waited to the deadline to submit my Great Lakes Residency Conference slides to our graphics department, where they would convert somehow our graphics in the computer to an actual slide. And yes, we were actually using slides at the time, and that's a whole nother set of challenges. But that night, there was a small fire at UW Hospital. And when I didn't receive my slides, I later learned that my slides were in the developer at the time and melted. So I had to start from scratch. I showed up to the Great Lakes Residency Conference, putting my slides in the carousel as we traveled to Great Lakes, and had never practiced with my actual slides. Somehow I made it through. The value of the UW network became evident to me quickly as I was looking for my post-job post-residency. I had a couple of interviews, but nothing felt right, and I was trying to coordinate plans with my soon-to-be husband, and that added some complexity. Fortunately, I happened to answer the phone when Mike Chester, a past resident, had called, wanting to see if there was still any graduating residents looking for a job. I interviewed for the position of Assistant Director of Clinical Pharmacy Services at Freighter. And although I'd never even heard of Freighter at the time, I knew before that interview ended that that was the right fit for me. It was the people, the drive for high quality, the willingness to change. This is much of what has kept me at Freighter for the past 30 years. And while I received a few phone calls over the years from other organizations, and even went as far as interviewing a couple times, I've never found a better fit for myself. Freighter at the time was a much different organization in 1991 than it is now. We were a small community teaching hospital that shared a medical team and emergency department with Milwaukee County or Doane Hospital. In some ways, I felt I was so well prepared coming out of residency. In other ways, I felt totally lost. Unlike the UW with the smaller department of pharmacy, we did not have separate teams or people to write P&T monographs, run the meetings, conduct MUEs, manage people. I was doing it all in my role as assistant director. and quickly realized I needed to adjust my expectations to a more reasonable level. I was fortunate to work with excellent people from the start, including Tom Newkirk and Stan Kent. As a relatively small, nimble organization, however, we were able to move quickly to establish new services. In collaboration with our providers, we established OR pharmacy services within a year of my start, investigational drug services shortly thereafter. As we built these services, I was so grateful to have the resources and expertise that I could lean on from UW. Change and growth in Freighter has been pretty much the constant since I've started. We purchased Doane Hospital in 1995 and doubled overnight, and the growth has not stopped since then. My primary goal when I accepted the position at Freighter was to establish a residency program. The training at UW had been so fundamental in my learning that I felt compelled that we should be doing the same at Freighter, and with leadership support as well as funding to get the program off the ground. However, it was only myself and 2 clinical pharmacists that had residency training. It was a foreign concept to all others, and preceptor development became essential. Our first resident, Debbie Gillard, started in July of 1993, and in fact still works for us today. After a couple of years, we expanded to 2 residents, and a few years later to 4, and then on up from there. I believe it was our residency accreditation visit a few years later when Stan Kent was our surveyor. He planted the seed about creating an administrative residency program. Our growth continued from there with PGY2 programs and a number of PGY2 programs and expanding the number of residents we were training. I'm so fortunate to work with a leadership team that supported pharmacy residency growth as we now train, as Tom had mentioned, 41 residents and over 15 different programs between our PGY1 and PGY2 programs. It is truly a team effort, and our residency steering committee provides the oversight and allows a systematic and standardized approach across programs. As I've worked with program directors and leaders to develop these programs, my approach has been to provide support and guidance, but then allow the flexibility for the program director and the autonomy to design the program in the way that they wish. I will say there is a true sense of pride in seeing the accomplishment of our past residents, many of whom are now preceptors and program directors themselves. Outside of my role in residency training at Freighter, I've been fortunate to be on the ASHP Commission on Credentialing for 6 years, including the leadership positions. At the time I was nominated, it was not something I necessarily was interested in. But one thing led to another, and despite being overwhelming at times, serving on the COC has been one of the most rewarding aspects of my career. I have learned so much as a part of those relationships and developed long-lasting friendships. In addition with that is my experience as a residency surveyor for various programs. The opportunity to visit these programs and interact with other program directors and preceptors has been so valuable in learning and seeing new strategies and approaches. I've learned the importance of being open and flexible to new opportunities because I could have said no at the time, but I just kind of went along with it, and it ended up being one of the best experiences for me. My role in medication safety began to take shape in 2000, shortly after TAIR's HUMAN was published, and a partnership was led by our hospital president CMO to form between Freighter, MCW, and the American Society of Quality to explore the possibilities of using Six Sigma methodologies to improve patient safety. I jumped at the opportunity. Over the period of 4 months, one of our quality leaders and I spent 4 weeks in Dallas completing our black belt training with Six Sigma and a group of engineers. Not only was the content challenging, but it was taught in terminology and examples that were so foreign to us. To this day, I do not know what a wave solder board is, but it was used in examples all the time, and we couldn't figure out what it was. My class project was improving safety with the IV infusions, which has subsequently laid the foundation for much of the work that I've done with infusion pump devices and smart pumps and interoperability. While the classwork was difficult, it resulted in improved safety for our patients and showcased the importance of patient safety at the leadership level. A number of state, national, and even international speaking engagements followed, and through the process, we had a chance to work with a variety of different professionals within and beyond healthcare. Taking advantage of opportunities and making sure to learn from one another was my lesson. Making sure to learn from each one was my lesson here. Jim Clark, our newly hired director of pharmacy, recognized the need for additional focus on safety. Jim pushed me to make a choice between the work I was doing with formulary management and medication safety. While I was reluctant to give up anything, he had a vision. Medication safety was my passion, and an area of practice that hit close to home as my dad had landed in the ICU, resulting from a preventable adverse event. Thank you, Jim, for your vision and leadership. While safety remains a passion of mine, there were challenges along the way as we established the role that was new to not only us at Freighter, but the nation as a whole. Initial priorities include developing a medication safety committee, creating structure around our environment, and driving event reporting, encouraging the conversation surrounding safety as well. I learned that although we all agree the importance of patient safety, we often have very different ideas of how it's carried out. Some of the conversations with the anesthesia colleagues were most memorable. Despite this, collaboration and problem solving with interdisciplinary teams continues to be one of my favorite aspects of the work in medication safety. Safety culture and communication surrounding events has come far, although with many organizations, but there's still work to be done. We need all of our staff members to feel supported when they speak up with concerns, and equally important to have peer support and resources available as staff are involved in events. One of the most significant challenges with this work it depends on everyone, and even one or two people exercising a little bit more intimidating behavior can derail this. So my request to all of you is to continue to promote the safe culture within your environments. All right, so let's see if we can pull this all together. Are we okay on time?
You're doing great.
I can still talk. So let's circle back to see and pull these concepts together where we started from both a personal and professional perspective. So collaboration and relationships. The value of teamwork and collaboration cannot be understated. It is something that has been ingrained throughout my career, and while engaging teams in the work sometimes makes a slow progress, the end result is inevitably more successful as we're incorporating different perspectives and learning from one another. Collaboration through professional organizations such as ASHP, our state organizations, Vizient, and others facilitates the accomplishment of something much more substantial and widespread. Furthermore, it allows us to expand our network and form friendships and relationships. The profession of pharmacy is close-knit, small world. Connections and relationships were key in my first job at Abbott Northwestern, my decision to pursue residency, my position at Freighter, and opportunities with ASHP. If you are in a position to do so, please help and continue to sponsor and promote others in the profession. Value and nurture your relationships, both personal and professional. And I have not always been good at this part. From a personal standpoint, this past year has just further emphasized to me the value of people and the value of relationships. I've been amazed at the support I've received, whether it's a text, a card, flowers, emails, a meal, or a kind word. I have a new perspective and a new appreciation for frontline caregivers, and that they care, the care that they provide the patients. I'm grateful for all these new relationships, and it brings a new perspective when I've been so much about the system and process all this time. So what have I learned? The importance of making sure others feel supported, following through on our relationships, and having the right thing to say is less than just being there for the person. Whether it's walking with another friend who's going through something difficult or a colleague, just being there to support someone, it goes a long way. Coaching, mentoring, the development of people. Mentoring relationships are dynamic and may look different from time to time. DZ called my attention to a recent article in the December edition of the AJHP that highlights some of the characteristics as well as terminology. Despite its importance, it took me a long time to realize the value and seek out mentorship. For those of you in residency or recent graduates, I cannot emphasize enough to you the importance of establishing mentorship beyond residency, especially in those first few years. Don't overlook the value of a brief impromptu mentoring session. My involvement with ASHP, COC, and my participation with accreditation visits have fostered so many mentoring relationships. Toby Clark, Bill Miller, Chuck Daniels, Shabir Samani, Janet Teeters, Janet Sylvester, and so many others. While the intent of our conversations may not have been mentoring, that evolved from our conversations. As an RPD and preceptor, I've had the opportunity to mentor many learners. Each relationship is unique, with some conversations scheduled from month to month, and others just on a moment's notice. Oftentimes it seems to be at the bottom of a ski hill or a restaurant or someplace completely out of expected. And finally, resilience and flexibility. Flexibility goes hand in hand with resilience, at least in my mind. It's important to recognize that we cannot control everything, So we need to figure out a way to adapt and move forward. It doesn't mean giving up on our goals. It just may mean adjusting our goals or adjusting the path to get there. The COVID pandemic has been a lesson in resilience and flexibility for all of us over the past 2 years. It has challenged our priorities, prompted new ways of thinking and working, and required us to change direction on a moment's notice. Resilience is important, but it's also important to recognize that there are times when it's difficult, and that's okay. And the importance of taking time for ourselves, supporting one another, asking for help. From a personal perspective, my journey with cancer this past year has challenged me even more than the previous year of adjusting to the pandemic. I had no choice but to be flexible with my plans for the remainder of 2021. From a resilience standpoint, I tried to stay positive and learning from every situation and relying on relationships and others to help get me through. So to wrap up with just a couple more additional acknowledgments. So I'm thankful and grateful certainly for Durant's vision for creating a safe medication use process, as well as his vision for establishing the residency forward and all that carry this on to this day. Thank you again to ZZ, Pam, TT for your leadership of UW Health residency programs, as well as your mentorship over the past 30 years. To my many, many mentors, colleagues, peers, friends, and all of you that have been part of my personal journey over the years, thank you. Special recognition to my incredibly talented team at Freighter, including Jim Cloud, Justin Conkle, Kate Skosma, Garrett Newkirk. Certainly I'll put Phil Brumman in this mix as well. Really appreciated the work and the guidance and the partnership over the years. And I certainly want to acknowledge my husband Tom and our children Connor, Jaden, and Bennett for their support of my career and understanding that scheduling challenges and professional commitments have come along the way sometimes interfere with our family life. Added comment, especially to Joelle and Connor for letting me bounce some ideas off you a couple months ago and figuring out how to put this together. And Connor for your late night editing last night. Thank you. Thank you, everybody. Let me see here.
Yeah, you want to slide over and I'll join you. Real quick. So in the world of technology, we're going to make a little bit of a transition here for a few other members to join us. But while Lori is helping me out on that front, I wanted to say thank you, Kristin, to you for being here today, for providing those words for us to consider. They definitely have given us a perspective that we should consider and a lot of themes that we can carry forward with us in the coming years. I would say your perseverance and resilience definitely shined through, and it was great to have you here today. I just wanted to say congratulations to you too for receiving the 2021 Winston J. Durant Lecture Award. So thank you. And those on the call, if you know how to celebrate in WebEx, you can use the animations. There's some funfetti, round of applause, thumbs up, others you can send through. So I appreciate that. Lori, we ready to go? You want to share the slides too, and we'll get started again. So we're going to try something a little new here in the Durant Lecture Award. We're going to put together a reactor panel here, and so as Kristin has shared some words with us today, through her lecture, we thought it would be good to include others that have worked with and influenced her over those years to provide their perspective on what Kristin shared with us and how they have worked with Kristin through the years and the work and effort that she has carried forward. So we're going to start out with Jim Clark joining us. So I believe, Jim, you, yourself, DZ, and Pam will need to take yourself off mute as we go forward. But Jim, I'll turn it over to you. And if you want to check an audio, you're welcome to do that as well.
All right. Thanks, Jack. Can you hear me okay?
Yeah.
All right, great. Well, first, I just want to extend my own formal congratulations to you again, Kristin. Definitely very well deserved for sure. Excellent job on your address. Most definitely, it was one that touched the heart as well as inspired the mind. So thank you for that. And maybe before I react directly to what Jack has teed up for us to weigh in at, I just want to say what a privilege it's been to work with Kristin over the years. It's been 20 years as she and I have worked together directly and indirectly. And when I first arrived 20 years ago, Kristin and I were the only two master's administrative trained residents or leaders in the department at the time. And as she made mention of, that grew very steadily and quickly over the years. And but from my very first days there, she was always an exceptional and insightful partner on all the challenges that we would face together. And there were definitely many, but there were good opportunities and great successes along the way. And in fact, I found that, as I arrived in her initial years, like you heard her mention, I was great to hear that recap. She was already doing so many great things and working with exceptional teams and getting the OR started in the residency program and the IND, investigational drug. And in fact, the residency program, I remember when I arrived, was really just 3 residents, and we were really proud of that program. And so it grew very quickly, as you heard Kristin describe, and she was the key leader for that, and it's just great to see it become what it's become today. So having said those things, that kind of ties into maybe a couple things that I'll share to get things rolling in terms of reaction that resonated with me from her talk. As she shared, I would echo and maybe attest to the value of relationships and collaboration. And I would say those 2 elements continue to be, in my mind, what really sets apart the strongest leaders from the pack. And to this day, I continue to see sometimes the smartest, most knowledgeable and insightful leaders struggling to be successful because they're failing in those areas and not maybe creating a shared vision or soliciting buy-in or being able to work through obstacles with other key stakeholders in an organization. But those things are absolutely key strengths of Kristin's, and I've observed her to be very effective in so many ways in helping and using those to help her many accomplishments. I was especially happy to hear how she's the daughter of the master of building relationships. I didn't know that until I heard that, but I think it's just such a great fit because as I look back on her accomplishments, the Six Sigma, the new med safety position, and the projects that came along with it, all those things that involved interdisciplinary teams, she did so well and so effortlessly, and it was because of her strength in the areas of relationships and collaboration that she does that so well up until this minute today, and it's just great to see. And with that, so maybe something that I would throw out to the group for discussion as we finish these remarks might be, how can we continue to sharpen those skills or maybe be as effective with them as we enter a new norm of more remote meetings and maybe less time at the water cooler or certainly as many casual curbside interactions as we've been used to previously. It's going to take really some extra effort, extra focused efforts to make that work. And so I think something that it's always a challenge for us, but maybe especially as we come out of COVID. Maybe a second thing that I would add in reaction to some of her comments that resonated with me from her remarks was that of resilience. As I thought about resilience, I always like to describe it as we're weathering, challenging situations, we're weathering rapid change or maybe dwindling resources and supports, and we're doing that over an extended period of time. And all while we're trying to muster the right energy and motivation to press ahead and keep things on track. I think it's something that we need to be effective as leaders, but we also need to guide our leader teams. We need to be able to help our staff along the way as those situations present themselves. And I know Kristin made mention of, a lot of the rapid opportunities for change and growth in the department at Freighter, but there was also for her personally those health challenges that were layered in as well that further added to it. And something that we can all relate to as we're now entering what is the 3rd year of our COVID crisis. And I think we're all in need of some further resilience that way. And so maybe just something else I would throw out to the group, maybe for some later reaction would be, just that, even if we think we can catch our breath after 2 years of COVID, how will we handle whatever that post-COVID new norm is? That could be tech shortages, budget crunches, maybe new competition in the healthcare space. And not to mention the personal and family health issues and other family challenges that might enter the equation. Maybe just something for us to think about and even talk about further out of Kristin's remarks. So with that, maybe I'll just pause and turn it over to Pam or TT to further layer into that before we open up for discussion.
Yeah, thanks, Jim. Appreciate you adding those comments and perspective. And DZ, I'll check and see if you're with us as well and want to transition and give some thoughts and perspective from your standpoint.
Yes, can you hear me okay?
Coming through loud and clear. Take it away.
Okay, I have a couple of thoughts that come to mind. First, Kristin, I agree with everything Jim said. This was a very, very good presentation, very timely, insightful, and I think we all ought to, once it becomes put in print, read it 2 or 3 times. There's a lot of very good material in there. I'd like to pick up a little bit on what TT talked about, the Crumbyville heritage. People may or may not know that Dick, her dad, was one of the first young pharmacists that Durant hired. And I ended up working with him as a resident on weekends. You residents, we worked every other weekend then at that as well. And I was always assigned to Dick. And he was a very good coach and mentor. He would give me insight on little things as we worked in the dispensary, how to deal with people, what to look at going on around the department, et cetera, et cetera. And then after I graduated,
there a gaggle of residents and students out here?
It's all right. Getting a little perspective coming through. Go ahead, DZ. We'll see if we can't.
So after I graduated, I needed money a little bit, and Win and I think Dick got together, and Dick hired me as a weekend and an evening pharmacist at the Bergman Pharmacy. And he had a pharmacy, quote, delivery man who was a Madison police detective. And he actually was a pharmacy technician. When he wasn't out delivering, he was filling all the prescriptions and the like. One of the things that Dick did that stuck with me, it gave me a model of what I thought community pharmacy practice patient relationship should be. I can remember one time I was talking to a patient, we were all up on a counter, and he says, you never do that. You go down and meet them face to face. And the more they're struggling, the more you have to be at their level to make them understand. So he was a very good role model for me to understand sort of a community pharmacist-patient relationship. So I think, Kristin, you've kind of picked up on something as part of your gene pool going way back to your dad in terms of the belief of connecting with people, making them feel good. One other thing I'd like to share with you, I was just on a call in the last month, and we were talking about some residency issues, and I asked the question, well, you know, who's your coach or mentor? Well, I always think about Kristin Hanson first if I have a question related to residency. So your impact is probably more than you know. You get all the things I mentioned that are public, but behind the scenes, you've been influential in a very constructive way, perhaps a lot more. And again, congratulations on a great presentation. And I do have one thing that struck me about your presentation that I'll throw out for further discussion. Your Six Sigma black belt. Let me suggest we talk a little bit more about that, because I think in the next 3 to 5 years, we're going to have to go through another whole new level of efficiency in our operations in a way we have never had before. And it seems to me your experience and what you said might be a good starting point to start that initiative in a very big way. Again, thank you for the chance to participate today.
Thanks, DZ. And our last reactor for discussion is Pam Plutz. And Pam, let me check with you and see if you want to test out your audio and you're coming through.
I think I am.
You are. Go ahead, take it away.
Know, loud and clear, as they say. I too want to congratulate Kristin. I think everybody's proud of you. Yay. Now, the problem is that I was very sad to hear that the one thing you took away is my stacking system. That really is probably very, very bad, Kristin.
Wasn't it the filing system?
Yes, I'm sure.
Yeah.
And we, you know, I hope you don't have a boss that comes in and says, could you clean your office? No offense, TT. Um, I guess some of my comments, and obviously the things that you talked about today are in my wheelhouse. When you talked about relationships and collaboration, I think about one of the messages we need to keep reinforcing to people is how we should all treasure them, because most days when we're working, that's what makes work rewarding. It's not about really, the things you do or the awards or whatever. It really is the relationships that one builds. And, even the bad ones turn out to be either part of a good story or of an essential learning experience. When you talked about mentorship, the thing that occurred to me is that one, you never really sometimes know, like you also mentioned, that you are mentoring somebody or that you're being mentored. And that requires you to sort of always be cognizant of your behavior and what you're thinking, because you really are impacting others when you don't even realize you're doing it. When you talked about resilience, I think I have and always will have a problem asking for help. And I think that's, people who want to be successful, maybe that's sort of one of always our issues. And it's so important to ask when you need help and to not see it as failure, because everybody needs help. What do we get rewards from? We get rewards from helping others. So if nothing else, people would feel good about helping us also. One of the things that an early physician told me to help with resilience was to give yourself space to think. And I think sometimes we see that as a luxury, and we really need to build it into as a requirement for sanity for all of us who are in, especially those of you now in the work world. Thank God I am not. I think another thing that people have heard from me 1,000 times is to figure out early on whether you're an extrovert or an introvert, because that will help you navigate relationships and teamwork more than you can ever imagine. Another thing that I've always encouraged people and want to remind people, and I heard it in what you were saying, Kristin, is the relationships that you have in and out of work that help you do a better job when you're at work. So I think it's important for people to make sure they establish professional relationships outside of their immediate work environment, because it can help you with a variety of situations where you need some new perspective. I guess that's really, I think most of the things that she said, that Kristin, you said, were so important for all of us to be reminded of. And one of the things I read in the New York Times yesterday, which I think we can talk about, is that we are 400,000 healthcare workers shorter than we were before the pandemic started. Now, if that doesn't key you up for resilience, I don't know what will. Again, I'd like to thank everybody for giving me this opportunity, and Kristin, to again congratulate you. I toss it back to Jack.
Thanks, Pam. So yes, and as we had on the agenda, keeping us track of time, we have a few minutes here too reserved to really open it up for everyone on the call with us today. So if you do have a perspective to share, something struck you, from Kristin's words and lecture today, raise your hand and we'll call on you and or put it in the chat from the WebEx standpoint. And again, remember, you'll have to take yourself off mute as we identify you for any comment and perspective. And as people are thinking about that or considering, I'll see Kristin. Anything else come to mind or strike you as you heard some additional words from Jim or DZ or Pam?
Lots of things. Where to start? But thanks again, really, for being a part of this and your reactions and your contributions. Yeah, the Six Sigma comment that DZ had made, certainly, that is a powerful set of tools. I actually don't use Six Sigma nearly as much as I used to, but there's some common themes and some tools within that have really been beneficial. So it's certainly worth exploring, but I think some of the lean work and the process mapping really is valuable if we look at our workflow. Yeah, the whole concept of resilience, and I am not going to claim to be any sort of expert. I mean, there's a lot of great resources, and I started digging through some of them, and I'm like, no, I can't spend any more time digging through some of these right now. But seeking that out and supporting one another. And Pam, you said it, we hate to ask for help. I've never wanted to ask for help or even to accept help. And sometimes we need to. It makes us better as people and professionals. And I think that is it's an important thing to allow others to support us and help us. And I think that that's something that took me forever to realize. So, it's healthcare today looks so different, and the resilience is really important. And I think for those of you, people who are retired as well, there's a different set of resilience skills that we've all learned these past 2 years. So much more is needed.
Lori, let me check in with you. You have any comments or raised hands?
No raised hands at the moment. No comment. Oh, I have one now.
Go ahead. Who do you have?
Rick G.
Who is that?
Rick G.
Rick Easy.
Yeah, Rick Easy. You want to unmute yourself and share your perspective?
Well, first of all, I want to just say congratulations to Kristin. I'm probably one of the few in the audience that remembers Kristin as Krumbiegel more than Hanson. But it was always great to work with her. I think that the thing that always got me, or that I remember most about Kristin, is her compassion for others, her compassion for patients, and her willingness to help and participate and do things that are right, not necessarily the most efficient, but to do what was right for the patient. So I want to just once again say congratulations. It's a voice from the past, and good luck.
Thank you, Rick.
Stan Kent.
Hey, Stan Kent, why don't you go ahead and share your thoughts?
Thanks. Well, first of all, Kristin, I want to congratulate you. My hearing isn't as bad as DZ's, and neither is my sight. And, from here, you look and sound exactly the same as you did 30 years ago. So you're doing great.
Thanks, Dan.
So we first interacted right back 30 years ago or so.
Day one.
And I can't tell you how thrilled I was to learn that you were coming to work at Freighter, because, I really needed somebody to help me run that P&T committee. and it was like, Mike Chester, said you were coming, and then, but I really didn't know that much about you. I knew your dad, Dick, and I was just hoping that you were going to be following in his footsteps, and you did. And you were such a great help back then, and I could see that the future of Freighter was going to be great, even though at the time county was kind of circling the drain. And so I fled to Chicago. But anyway, I agree with everything that, that others have said. You did a great job building relationships and mentoring a lot of the clinical pharmacists and building that staff. And all you have to do is look at, what's going on there today to see that. And you should be very proud. So thanks.
Thanks, Dan.
Any others?
Not right now.
No?
Oh, it looks like Garrett.
Hey, Garrett, you're on with us. You want to go ahead and unmute and share?
Yeah, absolutely. And Kristin, great message, great words. And I think one of the things that really, has really engaged me over the last year or two, especially during the COVID crisis, is the value of Kristin's vision and ability to have that connection with the residents, connection with the teams, whether it's through our quality departments, the ability to challenge and have an open mind. Every time I go into a meeting with Kristin right now, and I have the pleasure to work with her on a week-to-week basis, it challenges me to think differently and brings that perspective. And, I think that team atmosphere, the ability to listen and bring those things together and that glue for our organization is amazing. And I think it's one of those lasting learning lessons that I've gotten from Kristin and really makes our department and our group better. So appreciate the work and really glad for your award in this great day. So thanks.
Thanks, Garrett.
Any others, Lori?
Oh, looks like Connor.
All right, Connor, you're on with us from Boston.
I figure I should say something, right? I don't have necessarily the experience or the insight that a lot of others have in your professional career, but I have the benefit of having been your son. And, a lot of the things that you said in your presentation ring true throughout your life, inside and outside of work. But I really wanted to focus on your resiliency and adaptability. The last year has maybe been under a bit of a microscope with all the health challenges you've gone through, but you've always had that, and I've always been impressed by your ability to pivot and adapt to any challenge that comes your way. You don't dwell on the misstep, the bump in the road, how it gets there. You're always thinking, how do we correct it? How do we get to the next step? How do we take the right step forward? I think the only time I've ever actually seen you flustered is when we woke up with an hour and a half to spare on a flight out to Seattle. That's probably the most fun I've ever seen you. Still ends up making the flight thanks to your quick thinking, decision making, and your resilience and your adaptability. I'm so proud of you. You spent your life celebrating my successes, and I'm glad we get to celebrate yours today.
Thanks, Connor. Nice pictures in the background. UW campus.
Any others, Lori? All right. Well, I know we're a little bit past our agenda as well, so I'm going to go ahead and transition us to next part of the agenda. As I do so, and Lori's getting us teed up for the next section, just wanted to add too that, as Jim said, we definitely have some big challenges as we face, building relationships and working on collaboration, particularly now as we look to transition out of the COVID pandemic, virtual working environment, and what does that mean, for us, for our departments, for our profession as we go forward. So definitely timely topics and conversation. And then also that flexibility and resilience are definitely going to be important, not only for us, but also for our staff and anyone working, in our departments and alongside us each day. So definitely appreciate those words, and they're timely in nature. And then as DZ, I'll finish with his, black belts and efficiency are always something we're going to have to focus on. So agree with you there, DZ, that's a topic and a conversation to pick up and carry forward over the next 2 to 3 years and beyond from there. So thanks for those words. All right. So Lori, we'll go ahead and transition. I'm going to introduce our next speaker on the agenda. Glad to have with us today David Foose, who is a resident of the class of 1985. He's going to be representing that resident class and taking us through a legacy presentation for a past resident who's no longer with us, Michael Melby. We felt like this was a good opportunity as we're coming together to be able to recognize, Michael's contributions to the profession and to our residency program and our past residents going forward. So, David, I'll check with you just to make sure you got good audio. You want to try that out, and then we'll get started.
I'm here, Jack. Can you hear me?
Sounds good. We'll transition the slides, and you just let us know when you need the next one.
All right, very good. Well, while they're teeing up the slides that I put together, I want to offer my congratulations to Kristin. I also had the pleasure of knowing your father, and he would be so proud of you. So congratulations.
Thank you.
In addition, I'm also a cancer survivor myself, and any day that you can arise and do things and share things with friends and family and do meaningful work is a good thing. So Jack, thank you for giving us this opportunity to share some reflections of a past resident. Our group talked about submitting Mike's name for the Durant Lecture Award, and the committee gave us this opportunity to share some things about Mike, and I'm taking this opportunity now to do so on behalf of our group. The others in that class of 1985 were Stephen Davis, Joe Botticelli, Dennis Pfeiffer, and Mark Verashka. Mike passed away in late December of 2019, and in January of 2020, several of us went to Bloomington, Indiana to participate and be present for Mike's memorial service. If you can advance to the next slide, please. And while you're doing that, before I start the remarks about Mike, the thing that struck me, when Pam talked about the deficit in healthcare workers, is that I think we're at the point right now where we may need to relook at the role of pharmacy technicians and paraprofessionals in what can be done in healthcare. I think every discipline is going to look at how can we best do what needs to be done, and the things that pharmacists can and should do remain central, but I think the distributive and the accuracy and error avoidance things that our operational folks do will be increasingly important. So that's my 2 cents on that subject. So let me talk a little bit about Michael for a moment. Michael grew up in Appleton, Wisconsin, and after graduation, went in the Navy, and I think Mike did a lot of growing up and maturing then, and came back and went to pharmacy school, getting his degree from Ferris State College in Michigan. And upon completion of that program, sought a residency at Bronson Methodist Hospital. And one of the past Wisconsin residents, let's see here, I think I have his name, and now it's escaping me, but recommended that Mike consider going on and getting a master's degree and going to the Wisconsin program, and he did. And that was, fantastic, and that's what brought Mike to the program. I wanted to just tell you why they call us the guys with ties. On the first day of our hospital pharmacy rotation, we were all down in a conference room learning about where the fire extinguishers were and how to successfully manipulate or navigate the UW hospital and clinics. And the leader of the group asked which department everyone was from. And as he went around the room, he came to us and he says, so where are the guys with ties from? And of course, we were from pharmacy, and we've been affectionately called the guys with ties ever since then. Mike also called us brothers of different mothers. And we've been friends for close to 40 years now. So after the residency, we scattered and went around the country, but we've remained close friends. And we would get together at ASHP meetings and the UW residency reunions every 5 years. But we decided that we really wanted to get together a little bit more often. So we started having Guys with Ties reunions every 2 years, and we took turns hosting those events. And we were planning to get together in Bloomington, Indiana in the summer of 2020. And of course, that didn't work out with Mike's passing in late 2019. But several of us did gather and were together nonetheless. Now, Mike liked nicknames. He had one for almost everyone. We called him Melbs, or his initials MJM, and he had at least one nickname for each of us. Now, I came into the program with the nickname Chip, but he used to call me C7 because my initials were CF. And Mike called Steve Davis Lloyd because that was Steve's middle name. And then Mark was from Nebraska, and he would always say Mark because they have some sheep over there in Nebraska. Or he called him Marky. And then I don't know how many people ever called Dennis Pfeiffer Denny, but that's what Mike called him. So he's Denny within our group. And then the king of the nicknames was Joe Botticelli. We called him Donuts, Bag of Pastries, Bowl of Chili. And some of you probably know him as another name or two. And finally, Mike kind of had a separate personal nickname for DZ. He called him the Bullet because he would walk down the hallway so quickly. So then in the early years of the residency, we really were competing for advancement and promotions, as people do, going out and branching into their professional career. But as the years passed, we began to think a little bit about the realization that there was more to life than just work, and we started to focus more on supporting each other. We shared our successes, our challenges, our failures, and in fact, at about the 25-year mark, we decided to write a paper on this topic, which was published in 2011. And it was about that time that we started doing monthly calls, and we were since. And then finally, it's not that uncommon for us to all be sitting watching a Packer or a Badger game, texting each other in our own time zones about the progress of the game. So let me tell you a little bit about Mike. Mike didn't have any children, but he knew the names of all of our kids and asked about them regularly. And he was especially close to Kalia Verashka, who had childhood cancer and passed away several years ago. Now, some words that people might use to describe Mike are as follows: unique, innovative, early adopter, visionary, futurist, leader, and of course for us, friend. Mike was also a foodie before that was even a word, and he was also an enophile or wine connoisseur. He loved to travel to Hawaii and Scotland, and he had a special love for Ireland and was able to make a trip in the few months before he passed away. Mike was also a hugger. He liked to give hugs before that really even became fashionable. And I missed that. And of course, as someone mentioned earlier, you can't even really do that anymore. It's taboo now. Mike loved the Packers, the Badgers, and the Brewers. And he was very competitive. He loved golf and was a recent winner of the Bloomington Golf League at his level. We used to love to get together and play golf as a group. Some of us, even the non-golfers, would sometimes walk along. And, you may have a good game or a bad game, but it was always sweet if you could beat Mike. So let me go to the next slide and let me tell you a little bit about some of the things Mike did in his career. As I mentioned, went to school in Big Rapids, Michigan, and did a residency there. Mark Paulson, he's a former UW grad. And so Mike was a classmate of ours in the class of 1985. And upon, finishing our program, the UW program, Mike went to the New England Medical Center and was a clinical specialist in surgery. And he was there for 2 or 3 years. And he did some faculty work with the colleges of pharmacy out there. And in fact, he was recognized as the Massachusetts Pharmacist of the Year by that MSHP. But Mike, I think, missed the snow and the Big Ten and the Midwest. And so he went back to Michigan, took a position as assistant director for clinical services and then director at Blodgett Memorial Hospital. And not too long after that, he was recognized by his alma mater, Ferris State College, as the Preceptor of the Year. Mike was also the president of the Michigan Society of Health System Pharmacists. And a few years later, he was elected and served on the ASHP board of directors. Well, then Mike's golf habit, as he described it, prompted him to look for a place where he could play golf all year long. And he went to Arizona and took a position at the Tucson Medical Center as the inpatient pharmacy manager. And he also was the residency program director. And as having been a residency program director myself, and as Kristin mentioned, and those of you who've served in that role, it's a big job. So Mike took that on and trained residents there. Jack, you can advance the next slide then. And after a few things there in Tucson, where he met and married his spouse, Mary, Mike would get a little restless and decided he wanted to move again. They moved to Bloomington, Indiana. I think Mary's father lived there. And Mike took a position at Bloomington Hospital. And that was, at the time, kind of a county hospital. I think it was Hendricks County. And again, recognizing the importance of residency program and residency training, Mike started or initiated the residency program there. And then that hospital was actually, merged with or became part of the Indiana University Health System. And so Mike took a position then at the Bloomington Hospital, and he was actually the director of the South Region of that IU health system. And Mike had a variety of roles there. He was given responsibility for, I think, the inpatient operations department. And then eventually he took over the information technology department. He led a conversion of the hospital information system from McKesson to Cerner. Those of you who've worked with those big hospital systems know what a big job that is, and Mike led that. And he also became a CEO of a joint venture there that in Bloomington called HealthLink. And after really doing some great things there at Bloomington Hospital, they were going to update and build a new hospital campus. And because of Mike's multidisciplinary work, he actually became the director of innovation and activation, with his primary responsibility being that of the design and implementation of a new hospital and health campus. Next slide. And I just wanted to talk a little bit more about some of the specific things that Mike did. He was responsible for the implementation of decentralized services at a couple of different places. And, those of you who've done that, that's a big job. And Mike actually did it twice. He did it at Blodgett Memorial in Michigan, and again at the Tucson Medical Center. And then while he was in Bloomington, he worked with on a CMS innovation grant program that focused on improving medication management and specifically transitions of care to eliminate and prevent medication adverse events. So, Kristin, I'm sure that you and Mike probably talked at one time or another about medication error reduction, or certainly focused on what really is a very important thing. I spoke with Jim Jorgensen, who actually came from the Minnesota program, but many of you know Jim from his work as the chief pharmacy officer at Indiana University Health System, and then more recently at Visant, the consulting company. And he impressed upon me how committed to the role of the pharmacist in patient care Mike was. And he really wanted to change the way that pharmacists see patients. So not indirectly or behind the scenes, he wanted to promote an opportunity to see people face to face. And he actually worked with the management engineering folks to build a new pharmacist care system and made that part of the work in the new facility. Mike also, because of his work with technology and computer algorithms, took some of the data that was available and combined both diagnostic and the risk of adverse drug events and developed a score that really assigned patients to a triage system of green, yellow, and red. And this allowed his staff to focus more on the people who needed more care. So the yellows and the reds. And it also allowed his team to do some workload balancing, self-directed work team, and his staff really loved him for the way that he did this and allowing them to use their abilities for the best impact on patient care. And he really documented and improved efficiency, according to Jim, along the lines of 36%, which is really substantial. And then Jim also told me that whenever the IU system wanted to pilot something, try something new, Mike was always the first one to volunteer. He took and redesigned their IV workflow and clean room process, reduced errors, and implemented that there in the South region, and then that went across the entire IU system. So really, Mike's career was that of being a leader, an organizer, and then in the last few years of his life, he was working with the Pharmacy Leadership Academy, which was kind of a joint project between the ASHP Foundation and doing some certificate or even college graduate level educational programming in the PLA, the Pharmacy Leadership Academy. Mike organized and presented in that fashion. So he really made a lot of contributions. And it's interesting to me how you can know people as your friend or your residency colleague, but unless you work with them at the same institution, you don't always know what great of an impact they have in their career. And so things like this Durant lecture and this opportunity we have today to recognize the contributions that Mike made is really great. So thank you for taking the time to recognize that. Let's go on to the next slide, though, because I certainly know that there are other Wisconsin residents who've also passed away. Did you advance the slide there, Jack? And I wanted to recognize some of those folks, and several of you may know some or all of these folks. I didn't know the first resident, David Spurkey, and don't know when he passed away, but he was from the class of 73. Larry Bowe, class of 78. Many of us knew Larry from his work at college and the hospital. Dave Lutomsky, a graduate of the 83 class. Michael Flagstad, widely known, very innovative, actually one of the early founders or really helped Visant grow and flourish, passed away in 1976. I'm sorry, he was in the class of 1976. He actually died in April of 2014. And then some of the more recent people that have passed away too. Janet Sewell Song from the pharmacy practice residency passed away in 2015. Maria Ajami, class of 2015. Lisa Gansky, or Lisa Reed, when she was a resident, came to Minnesota. I knew Lisa, and I knew her husband, Mike, passed away in November of 2019. And then Michael in December of 2019. And then last year in June, someone class of 1973, Robert Griffenhagen as well. So we wanted to recognize not only Mike, but others from the UW program that have passed away. So Jack, thanks a lot for this opportunity to recognize the contributions of our classmate and friend, Michael. I'll turn it back over to you.
Yeah, thanks, David. And you had a final slide here for some of our honorary past residents, but yeah, go ahead.
Yeah, thanks, Jack. Win being the namesake of the lecture award here, I had the pleasure of meeting and hearing Win speak several times. Kurt Johnson, of course, was a PharmD resident from the University of Kentucky and was on the faculty at the UW for a long time, and he was the research advisor for Steve Davis. Paul Parker, the longtime director of pharmacy at the University of Kentucky, who I also had the opportunity to meet, and many of you know, we would take residency trips to visit other notable institutions. And so Paul from Kentucky, and then Cliff LaChalais, who was one of David's contemporaries, the lead at Ohio State University. And so see, these are some of the honorary UW residents that have also passed away. So again, thanks for that, Jack, and I'll turn it back to you. Thanks again.
Thank you. Yeah, thanks, David, for sharing those words about Michael. It's always good and important to recognize the contributions of those that have come before us and have been part of our residency program and really have set the stage for many of the things that we do today and the successes that we have and carry forward. So we're gonna transition again in our program. I wanted to just share a little bit of information as Lori is firing up the website as well. We've had a little bit of restructuring here at UW with our uwhealth.org website. And so that focus has really gone more towards the health system services. But in doing so, we wanted to make sure we continued forward with access to the Win Durant Lecture Award, as well as some links to the actual Win Durant Legacy Fund. And so as Lori is working their way through, we've transitioned that to what we now call our knowledge base through the School of Pharmacy. So I have that link here. For those who are fancy smartphone picture-taking addicts, the QR code should work for you. If you snap it on your phone, it'll launch to it as well. But as Lori clicks the link here, it should pull up. This link will take you directly to the Win Durant page on our knowledge book here, where we have all of the past information about the overview of Win Durant, his 10-year plan. We also will be posting all the lectures of our past winners, and this will be the location too where we post the recorded session from today as well. I also wanted to call out for anyone interested in supporting the Win Durant Legacy Fund. This too will take you directly to the donation link through the Wisconsin Foundation. It is an easy hop over to that as well. So wanted to take the opportunity to highlight that for everyone here today as well. So with that, that's a majority of our programming today. We are going to finish up with a guided tour of the UW Health Pharmacy Services. The residents through our virtual residency sessions really helped put this tour together. We used it during our virtual interview sessions to really give those incoming residents a perspective and flavor of what we had to offer here at UW Health. So it was a good 18-minute video, and I'm excited to be able to share it with anyone here today who's able to hang on with us to be able to watch a tour of our current spaces. Yeah, go ahead, Lori. And as it finishes up, I'll come back on and do one final conclusion for the session. But we'll go ahead and take it away, Lori. I hope everyone that's with us enjoyed the virtual tour of UW Health. That's what we have going on here today in many of our buildings, from the pharmacy services building we started out with, to University Hospital, all the way through the pharmacy school and then out to the East Madison Hospital. So I wanted to say thank you again for everyone joining us virtually here for the Win Durant lecture today. And again, congratulations to Kristin for a well-deserved recognition here in 2022 for 2021. So thanks everyone, and we will sign off. Talk to you again.